Initially when we set up the project, we had quite an active role in doing the review and writing up the findings, organising the meetings and keeping the stakeholders engaged. And moving forward, we're hoping that the individual groups will take a more active role and we'll be able to step back and just help keep it moving and provide some additional support.
So in our practice, as part of the Health Literacy Action Plan, my role is going to be the Health Literacy Coach. A lot of our health professionals in our practice already know some health literacy. So as part of that action plan, we want to increase everyone's health literacy knowledge so that they can then increase the knowledge of our patients. So as a health literacy coach, what I'll be doing is observing our health professionals whilst they're in a consultation with their patients, and then giving feedback as to what they did really well and what areas that there could be improvement on.
Be flexible, keep talking about it, be prepared to change your ideas, and be prepared to listen to the patients and their suggestions. It can be difficult to change your thought process if you think you've been doing something right, but actually just for sometimes just a small degree of change, you can get the patients on board a lot more.
I think small steps at a time. It's a continuous quality improvement journey. There's not actually an end point. It's an ongoing process. So small steps, educational programs for your clinicians, self-review, encouragement of self-review, encouragements of supervision for clinicians so that they can reflect on their own practice. There's a whole range of methods that you can use and processes, but I think a key advice or tip is, take it easy, step at a time. Just know where you're going and just keep focusing on that.
The 3 practices involved in the pilot, the health literacy pilot, we were really lucky to have 3 quite different models that were being implemented in those different settings. So the value for the PHO is that we can take the learnings and the insights from each of those 3 different sites, because they'll be applicable to similar practices elsewhere. Like, there's not one model of care, there's a whole variety of models of care. And the learnings and the skills and the expertise that have come out of this process for those 3 pilot sites will be applicable in some degree. So we can use the learnings in other settings and help people. And I think it will always be there that we can buddy practices as well, so that those who have been through the process already can share their experience with similar practices and help them on their way.